I've seen a lot of disc injuries in my day, but my stepson's disc herniation story, that's a real stretch. Today, I'm gonna show you exactly how we've been using spinal decompression therapy to take pressure off his low back and irritated nerves. No gimmicks, no medieval torture tables, just controlled traction for a real disc problem. Coming up. What's cracking? It's Dr. Neville, aka Dr. Ginger Ninja, here at Sport and Spinal Rehab in Jupiter, Florida. This is my stepson Patrick, and he has a severe disc herniation and disc degeneration in his low back. In today's video, we're gonna go over exactly how it happened, his symptoms, his images, and exactly what we're gonna do to fix his back. It's spinal decompression. All right, so Patrick, tell me exactly how this originally started.
Doing a hamstring stretch where your back is flat against the wall and you're dropping your butt down into the corner with your legs straight out in front of you. And as I was pushing deeper into the stretch, getting a good stretch in my hamstrings, just felt a pop in my lower back. And it's been on and off pain ever since, trying multiple things to get rid of it with, varying results. So when it first started, it was just on the left side and down into my left glute. And it was like that for a while. And then as it's gotten worse, it spread out through the entire back and even numbness and tingling into my legs and pain in my feet.
So when did this originally happen?
In 2018.
Okay, so you've been dealing with this for quite a few years now.
Yes.
So tell me how you were originally diagnosed with this.
So after about a year of dealing with it, sometime in 2019, I got an MRI that showed a disc herniation at L4, L5 and a disc bulge at L5, S1.
Okay, and tell me about exactly what treatments you've had for this.
A lot of physical therapy. I've had 2 epidural injections in both disc levels and facet injections, PRP injections, and none of it has worked so far.
Okay, so after you had all that treatment, have you had any follow-up MRIs?
I've had 2 follow-up MRIs and each one has shown the discs degrading more and more.
All right, Patrick, so tell me exactly how this is affecting you each day.
So I'm an electrician, do manual labor, a lot of getting down, working on outlets. And there's some days I can barely make it through work. There's some days where I'll go to do an outlet and it's just my entire lower back locks up on me and I can barely move. And I've been bedridden for weeks at a time and I haven't been working for the last couple months.
So we're gonna look at Patrick's lumbar MRI and break it down so you know exactly what's going on. Okay, so this is the view from the side and this is the view from the top down. So looking at this side view, you can see where the disc is pushing out onto the spinal cord down where those nerves are coming through there. They should be nice and smooth there, but you see how that's pushing out there? That's where that disc herniation is at L4, L5. And then looking at L5, S1, see how compressed that is through there? That is where your disc degeneration is. That is kind of compressing down through there, creating all those modic changes at the disc end plates. So when I talk about disc degeneration, we're talking about the discs that act as spacers between each vertebrae. And when they degenerate, they really kind of compress on that disc and these exiting nerves that come out of your spine, causing axial back pain, sometimes pain coming down the legs, but a lot of times pain right across the entire low back. So this is what a healthy disc looks like with plenty of space for the exiting nerves. And this is more what a degenerative disc looks like, compressing on these exiting nerves. So on this axial view, where it's a view from the top down, we can see that there is a disc herniation pushing right on the spinal cord there and can even kind of compress along the nerves that come out on each side. And this nerve irritation is one reason that people feel symptoms beyond just back pain. In Patrick's case, most of his pain is in his low back, but when that nerve gets irritated, that's when he feels the tingling into one or both legs. That's why we always want to connect the MRI findings with the actual symptoms, because we don't just treat the picture, we treat the person. So now we understand what's going on with Patrick's low back from his MRI. I'm going to use spinal decompression to help alleviate that pain and correct that underlying disc herniation, and I'll show you and tell you why. Spinal decompression, it's a form of controlled traction. The goal is to gently unload the lower back and reduce pressure around the discs and the irritated nerves. We're not trying to yank the spine apart. We're not trying to magically shove the disc in. The table gently stretches and relaxes the spine in cycles. That controlled pumping motion may help reduce pressure around the irritated discs and the nerve area. Think of it as giving the spine a little breathing room. So now we're going to set Patrick up on the spinal decompression machine. So we're going to have him first kind of laying comfortably on his back, and we're going to wrap these padded harnesses around his torso and pelvis. So this kind of isolates the pelvis, and then we're going to strap the torso down to help isolate that lumbar spine when we pull it apart. And then we'll use the bolsters to kind of put some slack in his sciatic nerve so his low back is nice and comfortable. And then we buckle this part in so that we can attach the rope to the pelvic harness. Now we're going to program the decompression table. The settings are based on the patient's size, symptoms, diagnosis, and tolerance. This is not a one-size-fits-all. For a disc herniation, we usually start more conservatively and see how the patient responds. More force is not always better. The goal is not to win a tug-of-war against the machine. The goal is to create comfortable traction force that helps unload the irritated area. As the table begins to traction, it gently stretches and relaxes the lumbar spine. Most patients feel a pulling or stretching sensation in their low back. Some patients feel the pressure easing up, some feel relaxed. That's usually a good sign. What we don't want is sharp pain, increased leg symptoms, or worsening of their tingling. If symptoms increase, we adjust the treatment. The patient should always feel like they can tell us what they're feeling. Okay, Patrick, how are you feeling here?
Feels good. Just pulling my pelvis down. Feels like a gentle stretch on my low back.
Good. That's exactly what we want. No increase in symptoms at all?
No.
Good. Now, spinal decompression can be a great tool, but it's usually not the entire plan. For disc herniations, we also look at mobility, core control, hip strength, posture, activity modification, and which positions calm things down or flare them up. Depending on the patient, we may combine spinal decompression with chiropractic care, electrical muscle stimulation, rehab exercises, soft tissue work, and other therapies. The goal is just not temporary relief. The goal is to improve function, decrease pain, and get the patient back to a normal life safely. So if you're dealing with low back pain, disc herniations, or sciatica, spinal decompression may be one option to consider. But the key is determining if you're a good candidate. If you're in the Jupiter, Florida area and you're wondering what's causing your low back pain, give our office a call. And if you liked this video, check out this one. And of course, as always, punch that like button, subscribe, and we'll see you in the next video.